Hey, are you employed and you're trying to figure out exactly what plan can you take as you turn 65 and older and trying to figure out the different plan options? There's actually 4 plan options you have available to you. I'm going to cover those in this next video. Stick around. I'll be back in just a second to cover those. I'm going to be covering with you exactly what plan can an employee take that's 65 years of age and older. There's a lot of confusion around employer-based plans, Medicare, Medicare Supplements, Medicare Advantage. We're going to be covering all this, going over the 4 different plan options you have and exactly what's best for you. So what does it take to really understand what an employee can take if they're still working and they're looking at going past the age of 65 and continuing to work? If your employer is providing you health insurance, you need to be able to look at that plan, base it on premium, and you're going to also base it on the deductible out-of-pocket cost or risk. So some plans have high deductibles, so there may be a $5,000 deductible, and then you're paying maybe a 80-20, or you pay a small copay when you go to the doctor or specialist, but almost all services, typically on major medical plans, apart from state or federal government, are going to be broken down into 80% or 20%. 80% is covered by the carrier, and then 20% by you. So you have sometimes employee-based plans have high premium. And then a high premium plan for somebody that's a husband, maybe a husband and wife, and both of you are 65 and older. A lot of times you can go into Original Medicare, you can pay your Part B premium, go on to either a Medicare Advantage plan or a Medicare Supplement, either one, and have a lot less cost. There's going to be virtually almost no deductible. If you do a deductible on a supplement, it's going to be less than $300 a year. And then typically you don't even have 20% on the billable items for either Medicare Advantage or Medicare Supplements. Both plans can be a great option and great fit for the person that wants either or. Your exposure risk are higher on the employer-based plan because of the deductible, and then you're paying a high premium for you and your wife. So this is a typical situation if you're married and you're both 65 years of age and older. Now, what about if you're 65 and your spouse, your wife or husband, is a little less than 65 years of age and has to fill the gap with some form of insurance coming into Medicare? Well, again, we take a sheet of paper, put a plus and a minus in kind of a column, and you're able to then begin to itemize out the things that are important. One, what's the premium cost that you're paying right now? And then what the premium cost would be if you're going to have your spouse on their own standalone insurance, and then what your premium cost for Medicare, which will be Part B premium, and you're going to add those together and realize, okay, I can put my spouse on something for $300 a month. I can go into Medicare, I'm going to pay $174.70, and the combined total is a little less than my premium for my employer plan that I'm paying. And this is going to be, if your employer plan has a high premium cost for you, you need to be able to do this math. Then you're going to go to the deductible. Your plan has a very high deductible, let's say $5,000. On Original Medicare, your deductible exposure, if it's a Medicare Advantage plan, is 0. If it's a Medicare Supplement Plan G, it's only the Part B deductible. So for right now, that would be $240. And then we're going to go down into the coinsurance exposure. And then a lot of times we put kind of a column to say, what are, copay potentials? Well, your major medical plan that you're on with your employer-based plan is going to have copay or coinsurance for every access of care that you do. Typically a deductible has to be met, and then you're going to pay a percentage amount unless you're going to like a primary care doctor visit, specialist visit. So taking this sheet of paper and breaking down these costs as you see here on the screen will allow you to be able to say, okay, now I have a bird's eye view of exactly what am I going to be paying out in comparison to if I go on to Original Medicare. But if you take this sheet, it's going to allow you to be able to break down exactly what's my cost, and then in comparison to what my cost is now as opposed to going on to Original Medicare. Now let's cover just the 4 different plan options that you have to simplify this. Once you make that decision and you say, hey, I'm staying on the employee-based plan, great. Then what I would encourage you to do is be educated about your plans each year. So as you approach the year that you are going to retire, you're educated and you're dealing with a licensed professional that knows what they're talking about, that can guide you into enrolling into Medicare successfully and then enrolling into the type of plan that you want. And again, that's going to be a Medicare Advantage, Medicare supplement. With a supplement, you usually are going to add a drug plan. So let's go over the 4 different plan options that every person has. One is a Medicare supplement. And as you guys have ever watched any of our videos about the details of a supplement, we're going to simplify this down. You're going to pay your Medicare Part B premium, and then you're going to have a supplement premium. And that's going to range depending on your age, but most people that are 65 years of age, typically the females are going to pay a percentage less because your risk for getting sick is lower than us males. And the males are going to pay a little bit more, but typically anywhere from about $110 to about $135 premium is what a male is going to cost. A female can be anywhere from about $95 up to about $115 to $120 a month. So those are monthly premiums that you're going to pay yearly, and then you're going to have increases each year. Typically, it's going to be on the obtained age. So as you turn from 65 and you turn 65, and let's say it's August. When you turn 66 years of age, then your premium is going to go up by a percentage. Now we look at premium costs, and I'm looking at retiring, and I'm going to go on a Medicare. I'm coming off my employer plan. What are my costs? So Medicare supplement is going to have a premium for you and your spouse. And then you're also going to have a drug plan premium. Now, it's 2024. In 2025 of January, moving forward, what's called as the Inflation Reduction Act, which if you have not heard about that, you can get some additional content about the Inflation Reduction Act on our YouTube. We're going to be providing more and more content as the year goes on in 2024 about this, but there's major changes coming. And one of the major changes is the cost of out-of-pocket that anybody will pay on any drug plan, the max amount is up to $2,000 per year. So coming in January, there's going to be a lot of plan changes for a lot of people that are on prescription drug plans. Well, that information comes out in October. So how is that going to affect you? The Inflation Reduction Act is going to affect you by increasing your premiums for Medicare prescription drug plans, your deductibles, and potential of copay and coinsurance costs for your drug plan coverage. It's going to affect all carriers across all markets across the U.S. So it's kind of an oxymoron. Inflation, reduction, and there's an act, there's a policy. So it's going to reduce, but it's also going to inflate other costs, and you just need to be aware of that. So regardless of what you do in these 4 plan options, be aware of the changes that are coming up. Now, secondly, you can always choose a Medicare Advantage plan. That's going to be able to allow you to look at HMO or PPO Medicare or Part C plans. And those plans, as we talked about before, are network driven. They're great fits for people that are in metro areas or heavily populated areas for doctors, specialists, and hospitals. In rural areas, if you're in a rural area, a lot of times we say, hey, you probably don't want to do a Medicare Advantage plan because driving to the doctor and accessing care, you may have to go across a state line to a doctor or a hospital. You may be in an area where there's not a heavy population of access to the professionals that you need for medical, and we usually would encourage a person like that to do a Medicare supplement plan. But the Medicare Advantage plans are a great fit. That's a Plan 2 option. So if you're coming off an employer-based plan and you're trying to think about, like, what am I going to do? Medicare supplements, Plan 1 option. Medicare Advantage is option 2. Then you can just stay on original Medicare, and you can be exposed to all the deductibles and coinsurance costs that Part A and Part B services charge you. And guess what? Then a lot of times people are like, I just don't want to make a decision. I'm just going to stay on original Medicare. And that's okay. As long as you understand you're going to have the potential to have extremely high cost if you have anything catastrophic happen. And I wish I had a crystal ball, because if I had a crystal ball, I could tell you, hey, this is going to happen a year from now, 6 months from now, 5 years from now, but we don't have a crystal ball in life. So don't treat your health care from a crystal ball mentality, like, hey, I'm healthy right now, I'm going to remain healthy. Well, nobody wants to be sick, but people do get sick and catastrophic events do occur. So I would not encourage you to stay on original Medicare. That is an option. If you still choose to stay on original Medicare, the third plan option would be getting a drug plan. That means picking up the drug plan so it's going to cover the majority of the cost of your medication. Otherwise, if you're prescribed medication because you chose to stay on original Medicare and you get sick, the cost of your medication costs can be extremely high and can be catastrophic for you paying something out of pocket because you don't have a drug plan. And then the fourth, a retiree group coverage. Now, most companies are going away from retired group coverage options. if you do have one of those options and you're going to be paying a premium and having cost out of pocket and you don't know how that works with your Medicare, I would say get together with a licensed professional and let you do a side-by-side comparison that you can see and see if you need to stay on that retirement policy with an employer group. Now, if you're state, federal retirees, and TRICARE retirees, you actually can choose to enroll into a Medicare Advantage plan. It will work with your federal retirement. If you do it correctly, it works out great for some. Either A, stay on that solely, or you can put it with a Medicare Advantage plan for the benefits of the Medicare Advantage plan. If you are a state retiree, typically in our state, they are provided almost like a supplement benefit. It used to be a company called POMCO. That's changed now, and the state retirees, typically when we talk to them, we tell them not to do anything. Stay on your original Medicare, keep your employer retirement plan, and then a lot of times the state that you're in doesn't provide a prescription drug plan benefit, and you have to enroll into a drug plan depending on your state, depending on your employment package. If you have any questions about that and you're in a state where you're really confused about your options, not to confuse you more, but sometimes states will take their state employees for retirements and they give them all types of options. They give them Medicare Advantage options, HMO, PPOs, different plans. They do Medicare supplements, different plan options, and then sometimes they'll allocate for a prescription drug plan option. If that's your situation, I would encourage you to get in contact. Typically, there's a third party involved with administrating all those options. Get in contact with them, ask them for a licensed expert that's had at least 3 years of experience or more. 3 years or more of experience. If they work there and they know Medicare, they're going to be able to give you guidance that's accurate, and they're going to have enough information to be able to answer most of the questions that you're going to throw at them. If you get somebody that's brand new, not so much. They're not going to be when, where, and then what type of plan do you enroll into if you're employed. It all comes down to really nickels and cents. Doing the math, what do you go into? Again, it comes down to what you're secure with, what it's going to cost you, and then also access to care when it comes to network-driven plans or non-network driven plans, and then what can you afford to maintain and what type of coverage you want. It's very important to educate yourself. Guys, do like, subscribe. We'd love to be able to help you with anything, answer any questions, reach out to us. We'd love to have the opportunity to talk to you. Until next time, I'll see you on the other side.